Pregnancy is often viewed as a beautiful journey, but it can come with unexpected challenges. Many women face various complications that can affect both their health and that of their baby. From serious conditions like preeclampsia and gestational diabetes to less-known issues like urinary tract infections, each complication brings its own set of concerns. As a mom-to-be, understanding these potential risks is essential for ensuring a safe pregnancy. What are these complications and how can they impact you and your baby? In the following sections, we'll shed light on 10 common pregnancy complications that every expecting mother should know about. The more you know, the better prepared you'll be for a healthy and happy pregnancy. Please don't forget to like, share, and subscribe our YouTube channel. Number 1. Gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy, typically in the second or third trimester. It occurs when the body cannot produce enough insulin to meet the increased needs of pregnancy. This leads to elevated blood sugar levels, which can affect both the mother and baby. Risk factors include obesity, family history of diabetes, and being over 25 years old. Untreated gestational diabetes can result in complications such as preterm labor, high birth weight macrosomia, or the need for a cesarean delivery. Babies born to mothers with gestational diabetes may face low blood sugar levels after birth or a higher risk of obesity and type 2 diabetes later in life. Management involves regular blood sugar monitoring, a healthy diet, physical activity, and sometimes insulin therapy. Most cases resolve after birth, but women who have had gestational diabetes are at a higher risk of developing type 2 diabetes in the future. Regular follow-up care is crucial postpartum. Number 2. Preeclampsia. Preeclampsia is a serious pregnancy complication characterized by high blood pressure and signs of damage to organs, usually the liver or kidneys. It typically occurs after 20 weeks of pregnancy in women whose blood pressure was previously normal. The exact cause is unclear, but risk factors include first pregnancies, a history of hypertension, obesity, and advanced maternal age. Symptoms include severe headaches, swelling in the hands and face, vision changes, and abdominal pain. If untreated, preeclampsia can lead to eclampsia, a life-threatening condition involving seizures. Other complications include preterm birth, placental abruption, and organ damage. The only definitive treatment for preeclampsia is delivering the baby, but doctors may manage symptoms to prolong the pregnancy safely. This can involve blood pressure medications, bed rest, and close monitoring. In severe cases, early delivery might be necessary. Women with preeclampsia also have a higher risk of future cardiovascular disease, so postpartum follow-up and healthy lifestyle changes are important for long-term health. Number 3. Miscarriage, also known as spontaneous abortion, is the loss of a pregnancy before the 20th week. It is a common complication, affecting about 10 to 20% of known pregnancies. Most miscarriages occur in the first trimester and are often caused by chromosomal abnormalities that prevent the embryo from developing properly. Other risk factors include maternal age, previous miscarriages, infections, hormonal imbalances, and lifestyle factors such as smoking or excessive alcohol consumption. Symptoms of miscarriage include vaginal bleeding, cramping, and the passing of tissue from the vagina. However, some miscarriages may occur without noticeable symptoms, referred to as missed miscarriages. Treatment options depend on the type of miscarriage. In some cases, the body expels the pregnancy tissue naturally, while in others, medical intervention or surgery such as dilation and curettage may be required. Experiencing a miscarriage can be emotionally challenging, and counseling or support groups can be helpful. Most women who miscarry go on to have healthy pregnancies in the future. Number 4. Preterm labor occurs when a woman goes into labor before completing 37 weeks of pregnancy. It can result in a premature birth where the baby is born too early, leading to potential health issues since the organs, especially the lungs and brain, may not be fully developed. Risk factors include multiple pregnancies, twins, triplets, infections, previous preterm birth, uterine or cervical abnormalities, and lifestyle factors like smoking or drug use. Signs of preterm labor include regular contractions, lower back pain, pelvic pressure, and changes in vaginal discharge. If caught early, doctors may try to delay labor using medications like tocolytics, which slow down contractions, and corticosteroids to help the baby's lungs mature more quickly. Babies born preterm face an increased risk of respiratory issues, feeding difficulties, and developmental delays. Long-term complications can include chronic lung disease, vision and hearing problems, and learning disabilities. Regular prenatal care and managing risk factors are key to reducing the chances of preterm labor. Number 5. Placenta previa is a condition where the placenta lies low in the uterus, covering part or all of the cervix. It can cause severe bleeding during pregnancy or delivery. The placenta's position is crucial because it supplies oxygen and nutrients to the baby, and when it blocks the cervix, vaginal delivery becomes risky. There are different types of placenta previa: complete, where the placenta fully covers the cervix; partial and marginal, where it partially covers or is close to the cervix. The exact cause is unclear, but risk factors include prior cesarean sections, multiple pregnancies, and women over 35. Symptoms include painless vaginal bleeding, usually in the second or third trimester. If placenta previa is diagnosed, doctors may recommend bed rest, avoiding sexual intercourse, and regular monitoring. In severe cases, hospitalization may be required. Delivery by cesarean section is often necessary if the placenta doesn't move away from the cervix by the time labor begins. Most women with placenta previa can have healthy pregnancies with proper medical care. Number 6. Ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tubes. This is a life-threatening condition for the mother because the growing embryo can cause the fallopian tube to rupture, leading to internal bleeding. Ectopic pregnancies cannot result in a viable baby. Risk factors include a history of pelvic inflammatory disease (PID), previous ectopic pregnancies, fertility treatments, smoking, or structural abnormalities in the fallopian tubes. Symptoms usually emerge between the 6th and 8th week of pregnancy and include sharp abdominal pain, vaginal bleeding, and shoulder pain, which could indicate internal bleeding. Diagnosis is typically made via ultrasound and blood tests that check for lower than expected levels of the pregnancy hormone HCG. Treatment depends on the size and location of the ectopic pregnancy. Early cases may be treated with medication methotrexate to stop the growth of the embryo. In more advanced cases, surgery laparoscopy is needed to remove the ectopic tissue and repair or remove the affected fallopian tube. Number 7. Anemia during pregnancy is a condition where a woman has lower than normal levels of red blood cells or hemoglobin, reducing the oxygen supply to the body and the baby. The most common type is iron deficiency anemia, but folate deficiency and vitamin B12 deficiency anemia can also occur. Pregnant women need more iron to support the growing fetus and placenta, and insufficient intake can lead to anemia. Symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, and dizziness. Severe anemia can increase the risk of preterm birth, low birth weight, and postpartum depression. In rare cases, it can cause complications during delivery, such as excessive bleeding. Diagnosis is made through routine blood tests during prenatal care. Treatment typically involves increasing iron and folate intake through diet and supplements. Foods rich in iron include leafy greens, red meat, and legumes, while vitamin C can help improve iron absorption. In severe cases, intravenous iron therapy or blood transfusions may be needed to manage the condition. Number 8. Hyperemesis gravidarum is a severe form of nausea and vomiting during pregnancy that goes beyond typical morning sickness. It can lead to dehydration, weight loss, and electrolyte imbalances, often requiring medical intervention. The exact cause is unclear, but it's thought to be linked to the rapid rise in hormones like HCG, human chorionic gonadotropin. Symptoms include persistent nausea, vomiting multiple times a day, inability to keep food or liquids down, weight loss of more than 5% of pre-pregnancy weight, and dehydration. Unlike morning sickness, which usually subsides after the first trimester, hyperemesis gravidarum can last much longer and significantly affect the woman's quality of life. Treatment often includes hospitalization for intravenous fluids, anti-nausea medications, and in severe cases, nutritional support through feeding tubes. Managing symptoms at home may involve eating small, frequent meals and avoiding triggers like certain smells. Left untreated, hyperemesis gravidarum can lead to complications such as malnutrition for both mother and baby, preterm birth, or low birth weight. Number 9. Intrauterine growth restriction IUGR refers to a condition where a fetus does not grow to its expected weight and size during pregnancy, typically defined as being below the 10th percentile for gestational age. IUGR can be classified as symmetrical, where the fetus is proportionally smaller, or asymmetrical, where the head may be normal size, but the body is smaller. Causes of IUGR include placental insufficiency, maternal health issues such as hypertension or diabetes, poor nutrition, smoking, substance abuse, and infections. IUGR fetuses are at increased risk for complications such as low birth weight, preterm birth, stillbirth, and long-term developmental issues. Diagnosis is usually made through ultrasound measurements of the fetus and monitoring of growth patterns. Management may involve more frequent prenatal visits, monitoring fetal heart rate and movements, and planning for early delivery if the fetus shows signs of distress. Ensuring maternal health, including proper nutrition and prenatal care, is vital to minimize risks and promote healthy fetal growth. Number 10. Urinary tract infections. UTIs are common during pregnancy due to hormonal changes and increased pressure on the urinary tract from the growing uterus. UTIs occur when bacteria enter the urinary system, leading to symptoms like frequent urination, burning sensation during urination, lower abdominal pain, and cloudy or foul-smelling urine. Pregnant women are at higher risk for UTIs because the hormone progesterone can relax the urinary tract muscles, making it easier for bacteria to multiply. If untreated, UTIs can progress to kidney infections, pyelonephritis, which can pose serious risks for both the mother and baby, including premature labor and low birth weight. Diagnosis involves urine tests to identify bacteria and inflammation. Treatment typically includes antibiotics that are safe for use during pregnancy. Preventive measures include staying hydrated, urinating frequently, wiping from front to back, and urinating after sexual intercourse. Regular prenatal checkups often include screening for UTIs, as early detection and treatment are crucial for maintaining the health of both the mother and the developing fetus. Thanks for watching, and don't forget to like, share, and subscribe.